Humeral shaft fractures. Published by WordPress.com. Anatomy. Extends from the insertion of the pectoralis major to the supracondylar ridge. Deforming muscle forces, similar to proximal humerus fractures. Classification. 1. AU classification. 2. Descriptive classification. Clinical presentation, scheme plus. Radial nerve injury is the most common complication, presenting as wrist and finger drop. Treatment. Conservative management. Indications. Majority of humeral shaft fractures. Acceptance criteria. Less than 20 degrees anterior angulation. Less than 30 degrees varus, valgus angulation. Less than 3 cm shortening. Methods. Initial immobilization with coaptation splint or hanging cast, common. Thoracobrachial, Velpo, dressing or shoulder spica, less common. Functional bracing from the second week until union. Operative management. Indications. PVONU. Polytrauma. Bilateral fractures. Segmental fractures. Floating elbow. Intercondylar fractures. Open fractures. Neurovascular injury. Non-union or malunion. Pathological fractures. Gunshot injuries. Methods. ORIF. Open reduction and internal fixation. Indicated for proximal or distal fractures. Intra-articular extension. Narrow medullary canal. Radial nerve exploration. Non-union. Techniques. Anterolateral or posterior approach. 4.5 mm plates, narrow or broad. 6 to 8 cortices proximal and distal to the fracture. IMN, intramedullary nailing. Indications. Open fractures. Segmental fractures. Pathological fractures. Types. Antegrade. Insertion medial to greater tuberosity. Retrograde. Insertion 1 to 2 cm proximal to the olecranon fossa. Complications. Antegrade. Shoulder pain, subacromial impingement, or rotator cuff injury. Locking screws. May injure the axillary nerve, proximal screws, or radial, lateral antebrachial cutaneous nerves, distal screws. MCQ. External fixator. Indications. Open fractures. Burns. Infected non-union. Bone loss. Complications. Pin tract infection. Neurovascular injury. Non-union. Complications. Malunion with conservative treatment. Non-union with operative treatment. Brachial artery injury. Radial nerve injury.